Hello and good day here by Business Spotlight. My name is Bernhard Beckers from Action Coach Brunswick, and I'm very proud to have as special guest here Harald Mischak. He is entrepreneur from Mosaiques Diagnostic and also professor of the University of Glasgow. And Harald, you are very welcome here.
Thank you very much.
Harald, explain us the combination about entrepreneur and professor on a university. And what I learned, you are sitting currently in Hannover, and you are professor in Glasgow as well.
Yes. Well, that's a long story. I would say I actually come from academia. So I had an academic career. I started in Austria, then I was about 5, no, even 6 years at the National Institutes of Health in the US, in Bethesda, basically working on signaling, signal transduction, and trying to understand how tumor cells become malignant, how cells communicate with each other, basically how disease develops. And along these lines, I developed the idea to perform analysis of proteins and peptides in order to understand life, to understand disease. And I wanted to develop, let's say, technology and those solutions, software solutions that enable then the data evaluation to really assess thousands of proteins and peptides. Our body is composed of proteins and peptides, 10,000 actually, in fact, close to millions of them likely, and they really control every aspect of human life. They transmit the signals, they control the cells, they control cell growth, and so on. So it was quite obvious a deregulation in this balancing of protein in the communication will ultimately lead to disease. So having this idea to assess all the proteins, which is called the proteome, and there, how should I say, obtain information about disease-specific changes was something I wanted to follow once I came back to Germany after spending another 1 year in the US. Such a project, however, was not funded on an academic level. So I always got the feedback that I am quite a good scientist and they want to fund good science, but not ideas and illusions. It should be down to the earth of science. So I was a bit angry. And as a result, wrote a business plan. I submitted this business plan to the Stern business plan competition. And funny enough, I won the competition in Lower Saxony, and I was number 8 in Germany, even though I have to admit the business part of the business plan was pitiful. However, that was enough to attract funding from private investors and also public funding for the company. So I started the company to do exactly what I wanted to do in academia. That is to understand disease on a protein level, identify biomarkers, and thereby then guide intervention in patients. After a while, it became more and more obvious that this may actually work. At the time, I had a position at the Hannover Medical School, but once it became evident that my approach and this company that I founded, Mosaiques Diagnostics, may in fact be successful, the medical university told me that I have to make a decision to either leave the university and stay in the company, or to leave the company, ideally hand over the company to the university and come back to the university. Well, and the decision was to actually leave the university, leave academia. And that seems to be an issue in Germany altogether, that academia and the industry, entrepreneurship must not be combined, supposedly mostly as a result of conflict of interest. That's different in other countries, and at the time I was already quite well known. I was one of the leading scientists worldwide in the field of proteome analysis, and especially clinical proteome analysis. So of course there were many other universities, and one of them was Glasgow, who would be interested in attracting me. And the best offer came from Glasgow. It was the most interesting one. This is why I decided to take up a position at the University of Glasgow. This is how I basically ended up, on one hand, running a company, and on the other hand, having an academic position. The company is still running in Germany because it's quite difficult to move it, as you can imagine. The university position is still with Glasgow.
Yeah.
Because things are working out quite well, and actually working out quite well for both the company on one hand and the university on the other hand.
Yeah, and how does it work with 24 hours per day? I think you have.
I don't have a full position in Glasgow, and that's because that's not possible, of course.
Yeah, of course.
Yeah, well, 24 hours a day, as you probably can imagine, is never sufficient. On the other hand, by now I have quite a lot of co-workers support me a lot, and that certainly is helpful. And then, as I said, you have to make certain compromises. Also, at least in my business, from my understanding, it is important to be in close contact with academia, especially with university hospitals. So in as much this is certainly a benefit for the company, while at the same time the knowledge of implementation, the knowledge of transformation from academia to actual application for the patient that I have as an entrepreneur is quite helpful for the university. So in the end, I would say, of course, both profit.
When was Mosaic Diagnostic founded? How many years is it ago?
It was founded in 2001, so that's now 23 years ago.
Okay. And can you explain a bit more about the company and about the products?
Yeah, so the idea was to investigate proteome or the proteins, proteomic changes significantly associated with disease. We developed technology. In the end, the technology we decided to use is capillary electrophoresis coupled mass spectrometry. Basically, these are two different machines that can separate peptides and proteins. That's the capillary electrophoresis. And the mass spectrometer is basically an instrument that you could say is a very, very sophisticated scale. It basically measures the mass of individual molecules, proteins or peptides. And altogether, this enables theoretical resolution of about 10 million different compounds, so more than there are here. Of course, there are certain compromises that have to be made, but in the end, this technology worked. It turned out that as a specimen, urine would be best suited, mostly because urine is fairly stable. It does because it's stored in the bladder for a couple of hours at body temperature, so whatever is present in urine will not be quickly degraded, can be shipped. All of these are major advantages. And with technology, we can detect between, I would say, 3,000, 4,000 up to 10,000 different proteins and peptides in urine. We have done this now for close to 100,000 different human urine samples. And from all of these samples, using sophisticated statistics, we can extract the information what are specific changes, for example, in patients with prostate cancer versus those suspected but not having cancer, or patients with cardiovascular disease, again, versus those suspected but not having the disease, and so on. And these are, in fact, also the products. So the products enable a more accurate diagnosis of quite a number of diseases. We concentrate on the major diseases, as you can imagine, at an earlier point of time, and by now also prediction what type of intervention may be best suited for a patient. You may know that there is, especially with chronic diseases, cardiovascular diseases, the problem is that there are several different drugs available. They typically give a benefit to, let's say, 20 to 30% of the patients. The rest don't benefit, but there is no guidance at all for the physicians which drug to use for which patient. Simply unpredictable. But now when you think about it, the drugs actually work on the protein level. So a drug has a specific protein as a target, either activates it or blocks it. And if I know the protein, then I can certainly predict which proteins are changed, and therefore which drugs would interfere with the change, would bring it back to normal. This is what we are doing. So these are the most of the products. And of course, by developing this technology, we also realized, and I think that is quite obvious, that ultimately we also need better drugs. So we are now using all these data to develop novel drugs or to develop novel applications for old drugs, which is even better because for those we have a safety profile. And we now have developed the first drugs to be applied in the context of bladder cancer. We're right now trying to basically try to obtain the funding to run the clinical studies with these drugs. But we're quite convinced that this would reduce mortality in bladder cancer by about 50%, which is a lot.
Mm-hmm. That sounds really difficult, and it sounds like high technology. But who are the clients of these products?
Yeah, right now it's of course the patients mostly. Mm-hmm. In the past, it was private payers, patients that were able to pay for the test, which is not so expensive. It's 850 euros. But patients that were also interested in their health or interested in avoiding certain types of intervention. Just to give you an example, if a patient is suspected of having prostate cancer, if there's a suspicion of prostate cancer due to elevated PSA level, then the typical way forward is prostate biopsy, which means needles are shot into the patient's prostate. Now, this is not only quite inconvenient, but wounding was one of the main tumor promoting approaches in the past. So in other words, this also carries the risk of, in fact, initiating or promoting a more aggressive cancer, not a good thing. Recently now, the first German public health insurance, in fact, also agreed to reimburse the test for the patients. So it is getting more and more, but certainly still on a quite low level. The other customers we have is the pharma industry in the context of clinical trial to understand what is the exact impact of the drug on the molecular level.
It's quite interesting. When I ask for a client, my expectation would be who is paying.
Yeah.
But your answer was the patient, but the patient wouldn't pay because he has an insurance. And therefore you have a split between the user or the patient and the union who has to pay, and the third one who has to do the decision. That will be the medical man or a doctor or whatever else.
Yeah, I don't see it exactly in this way. In the end, I think by now, and people begin to realize more and more also in Germany, the public health insurance doesn't really cover the actual needs for the patients. And this is the same in other European countries. They basically cover the basic needs, and even those are not always covered. So either something changes drastically in the system, or the patients will have to face that in case they want good treatment, they unfortunately have to pay out of their own pocket, or they are privately insured. I would also say ultimately the decision is with the patient whether you want to take a certain test or you want to take the risk, because the patient is also the one taking the risk.
Okay. Interesting.
Yeah, it's the patient's decision to, for example, wait until they have the first heart attack.
Interesting. In the past, I'm an engineer, and my relationship to medical support was go to the doctor, do what the doctor said. Meanwhile, it changed. I prefer to think before and to inform me and do my own decision. But I think this market, especially the medical market, is quite difficult market with a lot of different developments.
Yes, no, it certainly is difficult, and I think I would say by now the most difficult is in fact the public payers, also the system there is in Germany, but also in other countries, and that's I would assume is also why more and more patients move away from the public payers.
That's the same impression.
I don't think that most of the health insurances have the health of the patient as their primary interest by now.
Yeah. And meanwhile, we have political influence as well, and therefore it's not clear.
No, but ultimately, I would also, I mean, it's of course your decision if you want to prevent disease or whether you want to take the risk and assume, well, I won't get the disease anyway. And in which case, if you're right, of course, prevention is of no value. Of course, if you were wrong, it was maybe a bad decision. The same for the, I said, if you are male, so if you have a PSA level, let's say of 4.5, then you can either do nothing, you can undergo a prostate biopsy, or you can take our test and avoid the prostate biopsy and get more certainty about the situation you're in.
It's a quite interesting subject, and I'm afraid that we can't talk about this topic.
Yeah, sorry.
Weeks. And therefore, I would like to switch over to the key subject of this format, to talk about your experience as entrepreneur. And therefore, I would like to ask you and you have a long lifetime as an entrepreneur, and therefore I would like to ask you about one of the key challenges in the past, what you fixed.
Right. In my line of work, I think one of the key challenges certainly is to find sufficient funding to actually run the project in a realistic time frame. So certainly one can find funding, but then at least at the time when I started and also a little bit later, a lot of what scientists promised all kinds of things to obtain funding, but they could never keep up the promises because it was by far too optimistic. So I think, finding funding on the realistic level is very difficult.
But funding should be a long time ago, I think so, and therefore we are 20 years later. What is the current challenges?
The current challenge, I think, is mostly to market our products a lot better. So, and I think this is certainly one of my shortcomings. I come from academia. I'm a scientist. I'm not a marketing specialist. We have tried different approaches, also with some agencies, but we frequently were disappointed by the outcome. As in other words, the cost of marketing was often higher than the revenue generated. It's very difficult, at least for me, to decide how to best market it, how to reach our customers. And I said, I feel the customers are the private patients in the end.
So you have already 20 years, no, 25 years, roughly 25, 23 years, but close to 25. But what are the targets for the next 25 years?
I'm not so sure about the next 25 years. The more immediate target is now really to enable more broad implementation of the test, or of the tests, I should say. And as I said, unfortunately, I do not have a perfect plan. So we are trying to speak with different health insurance companies. We're speaking with politicians. We are speaking with journalists. This is the most difficult task, to be honest, because their interest is typically quite limited. But in a way, we need to let patients or the population know about the presence of these tests, and then they can decide by themselves whether they want to use these tests or not. But I see this is the biggest challenge, because let's say that the technological challenges have all been solved. The products have been developed, they have been tested in quite large trials. Well, altogether we had more than 1,000 collaborators from different university clinics all over the world. So this has all been done, and now it's obviously time to implement the test.
Very interesting subject and a real challenge, no? Even after 23 years. This format is also for young entrepreneurs, and the intention is to present entrepreneurs with a long-term experience to give an example to young entrepreneurs. Now, how can it work, and what you can do or what you can't do. What is your tip for young entrepreneurs?
Oh, this is not so easy, because I think it depends very much on the area of application, isn't it? My point of view always was and still is that the products that are being developed and are being sold should be of the highest possible quality. And obviously this implies that we have a good plan forward how to generate such products, and try not to deviate from the initial ultimate goal.
I would say it's a big sentence for the end of this format, and I would like to say thank you very much for this really interesting European-wide interview today, and I wish you to continue your success as entrepreneur and as professor as well. Thank you very much.
Thank you very much.